The mission of this program is first and foremost to train highly skilled internists. We're a 425-bed hospital with all of the medicine subspecialties in-house. We want graduates of this program to have a foundation in internal medicine where they feel confident taking care of patients and their patients feel confident in the quality of doctor that's taking care of them. The second arm of our mission is service to the community. Northwest Arkansas is one of the quickest growing regions in the nation, and with that comes a lot of needs in terms of healthcare providers. And we want to train people who hopefully will fall in love with this area the way all of us have and want to give back to the community and stay here either as general internists or specialists. The third arm of our mission is developing skills as clinicians, educators, and researchers, because we feel like being able to teach medicine makes you a better internist as well. And so we've got dedicated curriculum and opportunities for teaching and research that help build on those skill sets.
In addition to your clinical rotations, we've developed a lot of curriculum throughout the course of your 3 years of training. So we have a mix of kind of noon conference, which is really case-based learning or topic-based learning, either with our subspecialists or with our general internists teaching on general internal medicine topics. Then we also have a dedicated ambulatory half day. So every Thursday afternoon when you're on your ambulatory rotations, we get 3 hours of time together where we can really dive into some of the topics that require a little bit more time and small group activities. This is a mix of simulations, which we do in our simulation center. It's a mix of communication skills where we may involve standardized patients and give you some of that real simulated practice in a low stakes environment. And then some other hands-on activities like ultrasound and procedure training. All of that at a fantastic facility that really has a wide range of pathology. We're not a large academic center, but we are a referral center for a lot of the region. And my patients are just as diverse and complex as they were working at a large academic institution, and there are lots of excited and dedicated faculty members, and you are going to get that one-on-one mentorship, that one-on-one education that I just don't think you're going to get somewhere else.
Our culture is very intentional that we want a culture where we have residents who are supported, who have great mentors, who have people who are experts in their field, that they get individual, personalized, one-on-one teaching. That is our culture here, is to support individual learners as a class of 8 residents to be in an apprenticeship style learning with folks who have been practicing medicine and providing high quality care for quite some time, but now have the opportunity to pass that on to new learners. Yeah, I think if you're thinking back to your 3rd and 4th year rotations and where you really learned the most, it was when you were paired with someone who is an expert in their field or someone who was really good at their job, whether it be inpatient medicine or cardiology or nephrology, and it was just you and them. Because I think that's what medicine has always been, and that's when you learn the most.
You have a responsibility in 3 years to learn as much as you can about the field of internal medicine, but then also shape what type of physician you're going to be. And that comes from your mentors, from the faculty that you work with, from the colleagues that you work with, and developing those practice habits that you see others do. And I think the group that we have here of teachers and residents are people who I admire, and I think anyone would be lucky to learn from them and shape their careers after them.